The strike began on October 21st, demanding restored pensions, guaranteed time for patient care tasks, and pay equity. Elizabeth Mesa has been a hospice clinical social worker for Kaiser San Diego for 14 years.
I find myself just wondering, how are our patients and families, how are they coping? How are they doing? I'm wondering who has passed away, who's gone without, any psychosocial support or intervention.
A new complaint by the union claims Kaiser understaffing during the strike has left hospice patients without emotional and psychological support, and in some cases, delayed pain management.
Patients were reporting pain to the medical social worker, the replacement worker, and that social worker was documenting the pain and charting that they would notify the nurse to address the pain, telling the patient that they would notify the nurse and would get their pain managed, and then never following up.
Kira Keegan is a researcher with the National Union of Healthcare Workers. She says that since the strike began, Kaiser cut staff levels by more than half among the medical social workers, and that's violating Medicare regulations.
Medicare has very specific requirements for how certified hospice agencies must be run. And during the strike, Kaiser is not fulfilling these requirements, understaffing their MSWs in hospice, and ultimately hurting patients in the process.
Keegan says temporary staff are licensed social workers, but may lack hospice-specific training. This lack of specialized training, combined with the rotating staff assignments, disrupts the continuity of care for both patients and families. This is troubling for Mesa.
But it's impossible for them to, do the job of 5 full-time staff that was already stretched to the limit.
Kaiser was contacted for comment, but they did not have an immediate response. In the interest of disclosure, Kaiser Permanente is a KPBS underwriter. Heidi de Marco, KPBS News.